everybody, this is Karen. It's been quite some time. And today is January the 24th. I think I got that right. Wednesday the 24th, which is 2 weeks. At noon, it was 2 weeks ago that I got my cat sunk his teeth into my hand. Now, he didn't bite me. It was nothing like that. First of all, let me explain. I don't have an aggressive cat. He is very temperamental, though, but for years, my cat Baby, which is laying right there, my constant companion, as I call him, since we lost our dear Russia, which was just recently, he is closer to me than ever. I mean, he sleeps with me, he eats with me, he does everything with me. But Baby's a good cat. He's the only one left, so him being totally alone of his brothers and sisters and stuff, yes, has made him depressed. He still cries and still looks for Russia. But anyway, getting back to my cat bite. When I sleep for years, if I sleep way too long, he will try to wake me up and he'll paw my face. If that don't work, he'll get my hair by, down to the scalp and pull my hair, which really hurts, or, put his teeth on my hand, without sinking his teeth into my hand. But I'll either turn over or else throw the blanket over my head. But 2 Wednesdays ago at noon, stupid me, I put my hand in front of my face and he sunk his teeth into my very bony, skinny hand. You can see the bones and everything. There's not much meat usually on a person's hand, but I really have thin, bony hands. So, imagine those sharp, long teeth grabbing hold of your hand. I went back to sleep for a couple more hours and woke up and I could not use my hand. My hand was not swollen, but it had curled up like this, and the pain was unbearable. So I commenced on washing and soaking my hand in Epsom salts. I meant real strong solution of Epsom salts. That's how I've always taken care of cat bites or abscesses. And I've had a few serious ones, but nothing antibiotics didn't take care of. But I've never experienced anything like this in my life. It got worse. So at 5:30, my girlfriend took me to the ER. Now there's no red going up my arm at this point. My hand is slightly swollen, but not anything, that would get anybody's attention. It was just the pain and that I couldn't use my fingers, move them, or do anything. So I never saw a doctor in the ER, which is incredible. There was only, looked like one entry wound, which had closed up immediately. So when the nurse, which was a male, tried to wash my hand, I let out a scream so loud it scared him and everybody else. And I kept telling him about the pain, and that I couldn't use my hand. I couldn't move it. I couldn't move my arm. It was in the bone, and it was going past my shoulder. But there was no evident sign of redness, blood poisoning or anything. So they should have opened the wound and cleaned it out, which they did not. They gave me a shot, gave me antibiotics, and something for the swelling, sent me home. Next day, I went to my family physician, and by this point, my hand is really starting to swell. The only thing she did was give me a shot of an antibiotic and told me not to take the anti-swelling medication that was also for pain to keep the inflammation down, would lessen the pain. So I couldn't take that anymore. And gave me prescription Tylenol, which I can't take ibuprofen and Tylenol anymore because long-term use of it as a painkiller has eaten up my stomach so bad. So anyway, being in constant pain in my hand just got worse, bigger and bigger. We're going to 4 times its size now, and no use of my fingers, and nothing for pain, and nothing that would work, because they refused to give me pain medication because of all the other meds that I'm on. And then I went back the second day, the same thing all over again. So here we go into the weekend, and I'm trying to tell my husband just how bad this really is, and I'm really scared because there is no use of my fingers, and my hand is now even larger than it was. Oh, I forgot to tell you, the second day that I went, the red streak started going up my arm, which was unusual because that usually happens sooner than that. So they gave me another antibiotic to take, plus a antibiotic shot. So I've been on at this point, 3 antibiotics, different ones. When I went back, okay, it happened Wednesday. Thursday I went to my doctor. Okay, Friday, red streak. Monday, no red streak. It's gone, but as you see, that portion that's all stitched up right there was so huge, full of pus and everything. Something was seriously wrong. And I said, I need, and I started watching a lot of films during that weekend on cat bites, finding out it's the most serious place on the body to get a cat bite. Needless to say, I insisted on going in the hospital, so she said okay, and they scheduled me for surgery the next morning. Let's see, went in there Monday, surgery was Tuesday, then it was Wednesday, and then Thursday. Okay, I think I got out Thursday. I saw the surgeon Monday. So next Thursday, the stitches will come out. But if you look at my hand, what you see is the top layer of skin, and it is shedding. It is coming off. I think that's due to, if the hand was that infected, it's going to shed that top layer of skin because that was like dead, destroyed. So it's like a snake shedding its skin, and it looks really gross. I don't know if I'm capturing it very well, but needless to say, this hurts. It's not a throbbing pain, because since I've been home, I've had not 1 second of swelling. While I was in there, the swelling was so bad and the pain. and all those liquids, I gained 20 pounds of water weight, and just all the unbelievable drugs for everything you could think of under the sun in me. And then coming off of that morphine was really a trip. I don't recommend it. It wasn't the super high dose of morphine, but it was enough to really screw me up. So it took me days at home to be able to get used to my surroundings, get over the paranoia and the withdrawals symptoms. Really messed my head up really bad. I made some video clips in the hospital. They're very, very short. I'll insert those. But this is what happens when you get a cat bite in the hand. I just want to say one more thing about the seriousness of a cat bite in the hand. There's a video, there are a lot of videos on cat bites to the hand and the different things that people can suffer and go through with their hand. Some extremely, extremely serious. More than this. So far so good with my hand. A physician from the Mayo Clinic talks about the severity of cat bites. It's called when cat bite, 1 in 3 patients with cat bite to hand hospitalized. Infections, common Mayo finds. And it's on the Mayo Clinic, the name of their channel. I'll put the link below so you can look at that. And the one thing that doctors in ERs, they don't take this serious. Not at all. From Wednesday to Monday, this infection got so severe that I am so fortunate that it didn't end up causing severe tendon sheath and joint damage to the point of a lot of patients have to have reconstructive surgery. Many surgeries having to have the wound opened up and cleaned out again, and damaged tendons have to be removed. You may end up having to go through therapy to learn how to use, do exercises to use your fingers again. Because I was so afraid, that I had to actually, I hate to say forcefully, but aggressively insist that I go into the hospital, which is the last thing I ever wanted to do, and have a surgeon look at my hand and do the surgery. Because if it would have went on the way that it did, first of all, I could have had a hand that was permanently damaged, that would have taken away my mobility to use my fingers, have many other surgeries. There's just no telling. But this is a result of going that many days with no one taking this serious whatsoever. It's like, do medical doctors do not keep up on medical research of any kind anymore because they're too busy? That's how bad it is today. And hopefully, if this ever happens to someone that gets bit by a stray or a pet cat, that you really need to know that even though you've had an infection in your hand before, like I have, and immediate care to my hand personally, which is something I didn't do right away because I went back to sleep, because the wound will close quickly because of the cat's teeth, because they're like needles. Like I said, I'm going to insert pictures through this video and real short video clips of me in the hospital. And like I said, today has been 2 weeks since all this began, and I have another week to go before I get the stitches out. My fingers look normal, as you can see. My hand, as you saw earlier, looked really ugly. I don't know if it's capturing it now, but all that top skin, that real thin layer of skin, is shedding away. Which, none of this is something I've ever experienced. And the first thing you should do when you get bit on the finger, on your hand, anything, is to mix a strong solution of hot water and a ton of Epsom salts. I've used it on my cats when they've had wounds, to get the abscess to come to a place where it open up and heal their wounds, because you really need to get at that abscess. So it's immediate soaking of your hand constantly, in a temperature water that dissolves the salts, and you will feel the sensation of the salts if you have enough. It feels like a numbing sensation. That stuff is a miracle. It truly is. So remember that, and then also seek medical care to start antibiotics. That's really important. You got to stay on top of it. But I tell you what, like this one, I don't know what was different this time. Maybe my immune system, which they say has a lot to do with it, being sick for so long, was very low. And maybe another thing is to have your cat's teeth, your dog's teeth cleaned, because they're living with all of this bacteria in their mouth, which causes gum disease and all kinds of tooth decay. So, that bacteria in their mouth can't make them feel very good either. And you don't want that to get out of control, because it can eventually kill them. So this was a really nasty one. The worst I've ever experienced. Yes, I have had cats for as long as I can remember, rescuing and raising cats. And this is the first that I've ever had this. And I gotta tell you what, I am more cautious, because it's your pet. Your pet loves you, you love your pet. But like I said, this wasn't an attack. This wasn't an aggressive, my cat was not aggressive to me. It was just his way of trying to wake me up. So regardless, it could have been a lot worse if he would have sank all his teeth, his top 2 teeth, instead of, it only looked like 1 tooth had punctured. He was just he just grabbed the loose skin, trying to get a hold of my hand to move it away from my face to wake me up. So, as funny as that sounds, this is the result of what can happen from just a casual nip, that may be playful. So take that very serious, everybody, okay? I hope that you will be informed by doing your research beforehand if you have a cat, and even if you have a dog, because you need to know what you need to do immediately yourself before you go see your doctor or have to end up in an ER. And that's a crying shame when you go to the ER and they do nothing, you know, because looking at my hand made everybody feel like there wasn't anything. And they didn't realize, of course, like I said, they haven't studied the research. For some reason, they're oblivious. And I can't believe that I'm the first one they ever encountered. But anyway, we will see how this goes. So this is 2 weeks today that this happened. And it's not pretty compared to my other hand. But if the camera shows the difference, you know, my fingers are almost the same size as the other. But you're not to keep it clean, you are not to get it wet, you are to keep it wrapped at all times. Like I said, that's the way it's been the whole time.
Anywhere.
I created a monster, it's not my fault.
My sister who snuck out of the hospital.
I smell like a big old cigarette.
Smell cigarettes.
Big cigarette.
Alright. Bye, sis.
I love you.
Love you too.
Yes, I was rebellious, and I'm a smoker that I needed to go outside and smoke, which got me in much trouble. But later on, they allowed me to after they unhooked my IVs. So anyway, with that, I want to thank you for watching this video. I hope just seeing my hand is enough proof right there to for you to take any animal bite that you get serious and to be aggressive. Please remember that. You are in control, you know, of your body. You know, you cannot trust anyone else when it comes to yourself. When you know something is really wrong, make sure you get someone to do something. So with that, I want to say thank you for watching this video, and please be more informed, and I thank you. This is Karen from Oklahoma saying goodbye.
Do not. Okay, it's recording now. Get ready to do blood pressure. It's just the nurse's hands. That's it.
I like the mercy.
A day in the life of my wonderful, beautiful sister.
And this truly is my life. In and out. Revolving door here at this hospital for me. They know me by my first name.
Alright.
Uh-oh.
Oh, that's not good, is it? Well, let's see. It says 132 over.
I'd like you to meet some of my friends. We have Mr. Liquid over here.
Oh, yeah. I'm always good friends with
And
that
Mr.
thing.
Oxygen and...
Whenever they have the morphine, that's my favorite.
You're supposed to be... You're the reporter here. I was gonna say I want somebody to record my surgery. Oh, too late.
Yeah. Okay, we'll be back in just a moment. There's the hand. Oh boy.
Let's get the whole
Okay,
show.
it's recording now.
Okay.
It's definitely recording now.
Okay, we're not supposed to be doing this. but we are
Yep.
going to reveal Frankenstein's hand. See, this isn't my hand. This is someone else's now. So this is how they had to attach it.
Oh, yee.
There, let's get a good shot of it.
Okay, yeah, that's pretty bad. Okay. All right.
Let's do a hand fashion show.
Yeah.
Okay,
All right.
here we go.
Wrap it up. It's still recording.
Let me see
I
if it
think I
smells
can-
good. Mmm. Nice and dry blood there. Yum.
Sounds like good for vampires.
That would be me.
No.
Are you recording it still?
Mm-hmm. Trying to get away
I
with
want you to
that.
get your money's worth, everybody.
You got it?
This is really an R-rated film here. It really is, because everything that I do is against the law.
And this is what happens when you get bit by your cat and you don't take care of it right away.
If you oversleep because you stayed up all night and all morning and your cat don't like it, and since he can't talk to you, he knows how to get you. He knows how to get your attention. That's for sure.
Anyway, yeah.
But that's the result of what people look at as superficial. But underneath of it all is where the real danger is.
Yeah, you really
Just
need to get it
multiplying and
taken care
growing.
of right away, huh?
Yeah, starts with a C.
Yeah, I don't remember what it is.
The bacteria,
Yeah.
which there are many different kinds, but
Anyway.
and today is 1 week. 12 o'clock was 1 week today.
You've been in the hospital. This is 2 days now. Surgery
It's
was
taken 'em-
yesterday at 9 o'clock.
It took me till Monday to get anybody to do anything about my hand,
Yeah.
and they didn't do anything until yesterday morning.
So this is part 1 of the procedure and what's going to happen. It's going to be weeks and weeks before you.
Yeah, I fought my way to get into a hospital and get a surgeon and get this done. Now I'm trying to fight my way to get out of here. They didn't want me at first,
Yeah.
and they didn't take it serious, but once I saw that it was serious, now they won't let me go.
Yeah.
So,
Anyway. Okay, well, stay tuned for part 2.
yeah, no kidding.
Okay.
Hi everyone, this is Karen, and those videos you've been seeing of me getting a cat bite in the hand. Pretty gross, but today I got my stitches out, and this is the beautiful hand, and it sure looks a whole lot different than it did. Anyway, cool piece.